My name is Dr. Heather Lau. I'm the director of the Lysosomal Storage Disorders program at NYU Langone Health, as well as the associate director of the Division of Neurogenetics. Today, I'll be talking about the COVID-19 pandemic and impact on Pompe disease. First, we'll talk about the multisystemic manifestations of COVID-19, and then we'll specifically look at how the COVID-19 symptoms and complications impact patients with Pompe disease. We'll look at how COVID-19 pandemic is impacting the access to therapy for Pompe disease, and then talk about what to do if you, a patient with Pompe disease, are exposed to COVID-19. And finally, we'll just comment on some ethical considerations related to the severe complications of COVID-19 in our patients with Pompe disease. So the typical symptoms of COVID-19 include fever, dry cough, and fatigue in many of the patients. However, other symptoms that we are seeing include a productive cough, shortness of breath, aches and pains in our muscles and joints, a sore throat, headache, chills. We're seeing some GI manifestations, including nausea, vomiting, and diarrhea. We might see some nasal congestion as well, conjunctivitis, or red eye. It's interesting that some patients are reporting the loss of their sense of smell or taste as well, which may be reversible once the infection resolves. So symptoms typically develop 2 to 14 days after exposure to someone who has COVID-19. Transmission is thought to be through droplet, by cough or sneeze. It's also thought to be through contact. So if you touch a surface that's been infected with COVID-19, you touch it with your hand, and then you touch your face, either your eyes, your mouth, or your nose, are all portals of entry for the virus. There are also reports of fecal oral transmission. The disease then starts to progress over 2 to 3 weeks and either can resolve with only some mild complications, or in other patients, it can lead to a severe course leading to weeks in the intensive care unit. Severe disease is manifested by development of pneumonia that can go on to an acute respiratory distress syndrome called ARDS, requiring mechanical ventilation. We also see some effects on the heart, including myocarditis and sudden death, as well as varying degrees of kidney dysfunction. So what is acute respiratory distress syndrome, or ARDS? It's a complication in pneumonia in this case, the infection of the lung, that then goes on to develop this massive inflammatory response in the lungs, leading to fluid that builds up in the tiny elastic air sacs called the alveoli in the base of your lungs. That fluid keeps your lungs from filling up with enough air, which means less oxygen reaches your bloodstream. And then this deprives your vital organs of the oxygen they need to function. The symptoms of ARDS vary in intensity and might be exacerbated by underlying medical problems. There's varying degrees of shortness of breath that can lead to inability to carry on a conversation without losing your breath, or walking across the hallway and becoming severely fatigued. You might have labored or unusually rapid breathing, as well as a drop in your blood pressure. In extreme cases, you can be confused or have extreme tiredness or fatigue. Complications of ARDS include blood clots that could go on to stroke, a collapsed lung from the high pressures needed to keep open the airways while you're on mechanical ventilation. You can develop secondary infections, including bacterial pneumonia or sepsis. You can even develop scarring of your lung tissue called fibrosis, which stiffens your lungs and makes it even more difficult for oxygen to flow into those air sacs. So when we look at how COVID-19 impacts patients with Pompe disease, it's important to look at each system that's impacted individually. So we see respiratory dysfunction, as I described, pneumonia and ARDS in patients with COVID-19. In patients with Pompe disease, whether it's the infantile form or the late onset form, those patients might have significant baseline pulmonary disease. We measure it by impaired pulmonary function testing. And in our late onset Pompe disease patients, they have diaphragmatic weakness. And at times, they do need CPAP or BiPAP. They may even have an impaired cough. We also see cardiac dysfunction in COVID-19. And that manifests as sudden cardiac death or inflammation of the muscle called myocarditis. We can even see prolongation of the QT interval. These are all observed in COVID-19. Sometimes it's due to the iatrogenic use of hydroxychloroquine that leads to this prolonged QT interval. So as you can imagine, in our patients with Pompe disease, in our infants who are early in their treatment course might still have residual hypertrophic cardiomyopathy, conduction disturbances, including issues with the QT interval, and arrhythmias. Our patients with the later onset forms of Pompe typically don't have hypertrophic cardiomyopathy, but we do still see some observations of arrhythmias, conduction disturbances, and even aortic dilatation. So these all need to be taken into account when a patient's being evaluated in ER for COVID-19 infection. And it's important to understand that, we're told that patients who are older have more risk of having severe complications of COVID-19. But because Pompe disease has onset in the infantile period, our children with Pompe, whether it's the infantile or the juvenile form of Pompe disease, are at increased risk of complications of COVID-19. And therefore, those should adhere to the guidelines to reduce exposure. Interestingly, in COVID-19 disease, we do sometimes see some liver dysfunction manifesting as elevation in the liver enzymes, elevation in ferritin, and alterations in the bleeding and clotting factors that the liver makes. This can lead to hypercoagulable states or coagulopathies, and it also is a sign to the treating physician that this patient might have a worse outcome with COVID-19. However, it's important that the treating provider understand that Pompe disease itself, our patients may have mildly elevated LFTs at baseline, independent of COVID-19 infection, and might have some mild enlarged liver. Obviously, their CPK or muscle enzymes are also elevated. So they need to understand where our patients' baseline values are so they can trend it to see if it's truly worsening due to COVID-19 as opposed to just the baseline function prior to infection. There are neurologic manifestations of COVID-19 infection. We're increasingly seeing reports of seizures associated with it, possibly due to electrolyte disturbances and in the management of a patient in the ICU. We are seeing increased stroke due to this hypercoagulable state. We're seeing hypoxic ischemic encephalopathy because of the poor oxygenation at times as the ARDS progresses. There are reports of necrotizing encephalitis or infection in the brain. We see headaches. We see peripheral nerve involvement, including an ascending paralysis called Guillain-Barré, as well as autonomic instability and cranial neuropathies. Typically, Pompe disease does not affect the brain, although in children who are surviving with the infantile form, we are seeing some white matter changes and learning issues. They typically don't have seizures or increased risk of stroke. Our late onset Pompe patients, including childhood onset or juvenile, and our adults, they do not have primary neurologic dysfunction. But if you can imagine, if peripheral nerve function is impacted by Guillain-Barré, or they are bedbound, their muscle weakness can be exacerbated or lead to more further muscle decline. In our Pompe patients, they already have limb girdle weakness, and this could progress if you have a severe course of COVID-19. We are seeing some renal dysfunction in COVID-19, and even in some patients requiring dialysis, they go on to require dialysis. But typically our Pompe patients, fortunately, have normal kidney function. So let's move on and talk about the impact of COVID-19 pandemic on access to therapy. In the US, we have an FDA-approved treatment for Pompe disease for both infants, children, and adults. And this is an intravenous enzyme replacement therapy called Lumizyme. These enzyme replacement therapies can be administered either in the infusion center or at home. So as the spread of the disease occurs in your community, as we saw here in New York, patients are becoming concerned about going to an infusion center and being exposed, or allowing a nurse to come into their home. So we started to institute certain practices to screen patients and the providers by phone before the infusion, looking for suspicious signs and symptoms of COVID-19, as well as potential exposures to others in the community. This is again screened for at the beginning of the appointment or upon arrival of the nurse to the home. If there is any symptom or a concern for exposure, they recommend a quarantine. The length of the quarantine depends on whether it's an exposure or if you're actually symptomatic. And then return to infusion is cleared by your provider. Now, with our rapid rise of infections in New York City, we noticed that we had some deficits or shortages of resources called personal protective equipment, or PPE. But it was very important for us to reach out to our infusion nurses and centers to ensure that our staff had adequate PPE to both protect themselves and protect the patients. Our healthcare workers were not yet routinely tested. We didn't have access to many tests. And so we were concerned that there could be pre-symptomatic spread. So people who are exposed to COVID-19 could be contagious up to 2 days prior to developing symptoms and theoretically spread it to our patients. So it's important that our patients and our nurses are protecting each other through masking and glove use, as well as distancing during the infusion. Nurses should be monitoring themselves in between visits by doing daily temperature checks, as well as looking for suspicious signs and symptoms. Now, as the epidemic progressed in New York City, there was a concern that some of our nurses were working in other units where there were COVID-19 patients. And so it was important for us to reach out to the centers and the nursing agencies to determine whether or not they had exclusive infusion nurses. And it was very fortunate that several of our agencies had committed nurses only to infusions. And those nurses that were helping at the local hospital were put on hiatus from actually administering any infusions for our vulnerable patients. And this was reassuring to both myself and to my patients. And this could be a strategy for other communities. So as there were shortages developing in healthcare workers, there was also a concern that even if we took all those precautions, we might have a shortage of nurses, or if we were starting a new infusion, to find another nurse, or to take on more patients. And so there was a discussion, and there is an ongoing discussion about whether or not our Pompe patients should defer infusions because they're scared of exposure or because of the shortage of healthcare workers. Ideally, infusions would continue during this pandemic. This pandemic may last for months. The risk of exposure could be there for months, and we need to figure out how our patients can get access to care. We do not want progression of their underlying disease, whether it's from muscle, progressive myopathy, or respiratory dysfunction. So it is an individual decision between you and your medical provider about your individual risk versus benefit of continuing infusions during the height of the pandemic versus deferring the infusions. And that is made by looking at recent assessments, your pulmonary function tests, your recent neurologic exam, your muscle strength exam, labs, and also your risk of prior infusion-associated reactions. And then it's determined between you and your provider whether or not you can take a risk of deferring infusions for 1 month or 2 months or longer. Regardless, if you decide to defer the infusion, it is important to keep in close contact with your medical provider to assess for progression of disease and to talk about when to resume treatment. Okay. So how do you prevent exposure to COVID-19? Well, as the disease begins to spread within your community, you'll want to start limiting contact with others outside of your household. You don't want to congregate in large groups. The limit or the maximum amount of people that you can interact with is dependent on your local guidelines. Here in New York City, we saw over time an increasing limitation on congregations with sizes of 50, and then sizes of 10, then less than 5. And now, at the height of the pandemic, we are now ordered to be sheltered in place. And that means only essential workers should be going to work. No social activities with anyone outside your household. And when you are outside, you can only go out for groceries, medical appointments, or exercise. And when you're outside in the community, you should wear a cloth mask to prevent spread to others, even pre-symptomatically, to maintain at least 6 feet from others as you're walking down the street. And if you're going into a store, we even have limitations of numbers of people inside a store at any one time. And when you're within that store, to maintain your distance. And while you're out, to not touch your face, because those are portals of entry for the virus. And to carry hand sanitizer to help prevent or clean your hands in between exposures. And upon arrival at home, you can just simply use soap and water for 20 seconds, and that will kill the virus. So if your community is not yet on lockdown, but you're in a high-risk category, such as having Pompe disease, you might want to consider removing yourself from going to work or school. And this is an individualized decision that should be made with you and your provider. It may not be possible, but it's a discussion that should be had. You can ask about remote learning, whether your child is in elementary school or if you yourself are in college. You can also ask your employer about remote working from home. That depends on the job. And then if you yourself are an essential worker, you might want to have a discussion about whether the risk of exposure is too great for you. You might need a letter from your Pompe provider outlining your increased risk of COVID complications to excuse you from your duties. So what happens if you are exposed to COVID? You should contact your primary care physician and/or your Pompe expert to discuss the exposure, or if you start to have symptoms suspicious of COVID-19. Even if you think it's just simply a cold or an allergy, it is too difficult to discern what it is in the early phases of the disease. And it's important to reach out to get some guidance on what to do. You should review your medications and your current comorbidities. And then you'll most likely be told to self-isolate, even sometimes within your home, to separate yourself from other household members who might be more vulnerable. And then you should self-monitor, which again means checking your temperature twice daily, looking for a fever defined as greater than 100.4 degrees Fahrenheit, and noting development of other symptoms. Not everybody gets all of the symptoms, and some people get unusual symptoms like the GI symptoms, or there's now a characteristic rash that's been described, loss of sense of smell or taste, in addition to the cough. Sometimes people don't develop fever, but they have the other symptoms. So it's important to note them down. Then you should discuss with your doctor about when should you go to the emergency room. Here in New York City, as the disease spread, our emergency rooms became overwhelmed with the numbers of patients coming there. And it was actually suggested that patients first call their physician or arrange for a telemed virtual health visit to assess how severe their symptoms are. And many patients who are mild are told to stay at home and to monitor and care for themselves there. That way, if they don't have COVID-19, they're not exposed when they come to the ER, and also to decrease the load or burden on our healthcare workers in the front lines. But it's important to discuss with your provider when you should go to the emergency room. And if you have Pompe disease with underlying cardiac or respiratory issues, you might be guided to go earlier than the other people around you. And in anticipation of needing to go to the hospital, it's important to prepare. So I recommend creating a to-go bag. And in that bag, you should put an updated list of medications, a list of your medical conditions, your advanced directives, cell phones and chargers, list of primary contacts, and a letter, possibly from your Pompe doctor, talking about your disease, what it is, and how it manifests in you. And that is because the ER doctor or the intensivist, or even whoever is at the front lines, may not know what Pompe disease. It is a rare disease. And I'm certain that you've interacted with other healthcare professionals that you had to educate about your disease. So here you're going to be in the emergency room. You might be stressed, short of breath, and may not be able to delineate all of the facts about Pompe disease. And so this would be a way to provide information quickly to the ER doctor. And unfortunately, in certain cases, hospitals are starting to limit visitors. So here in New York City, because it's so widespread, adults are not allowed to have any visitors with them, accompanying them to the ER or even in the intensive care unit. And so you're completely alone. Children are allowed to have one parent. So it might be good to have this to-go bag, and also put in that to-go bag the number, know your number of your Pompe doctor. Okay, so when should you seek medical attention? So here's a list of a few of the warning signs that should prompt a call to 911 or going to your local emergency room. The number one sign is trouble breathing. And as I stated before, that could manifest as severe shortness of breath, and you can't even carry on a conversation. You can't get up and walk across the room. You might develop rapid breathing or pressure in your chest or pain. You might also develop bluish tinge around your lips or face. And in certain cases, it could be severe enough that you're confused or difficult to arouse by your family member. Those are all significant signs of progressive worsening of your respiratory function. And that should prompt a call to 911 or going to your local ER. This list is not inclusive, and you should talk to your medical provider about any other signs or symptoms that are concerning for your particular medical condition. So let's briefly talk about some ethical considerations for patients with Pompe disease who develop severe COVID-19. As we see here in New York City, because we were overrun with the rate of infection, so many people were affected so quickly. And even though most patients recover from COVID-19 infection, the small percent that don't has led to a burden on our healthcare system because it all occurred at once. And what happened is that we have a limitation on our resources. We had shortages of the personal protective equipment. We had shortages of healthcare workers. And then we have shortages of equipment, including the vital mechanical ventilator, and even in some cases, dialysis machines. So the question comes up is, does the diagnosis of Pompe impact your eligibility to access advanced care? In my opinion, a diagnosis, a simple genetic or biochemical diagnosis, should not discriminate a patient from these advanced interventions. Because many of our patients are well maintained on their therapy, and some of our patients are actually diagnosed pre-symptomatically, and they have yet to manifest some of the signs and symptoms of this disease. We should not assume the patient has a certain level of respiratory dysfunction or muscle weakness just simply based on their diagnosis. So we need to assess each individual for their own disease burden and stratify by age, comorbidities that may or may not be related to Pompe disease, and the organ function at the time of evaluation, not about what could happen in the future. I have late onset Pompe patients that are diagnosed in their 20s and have yet to manifest any proximal muscle weakness or respiratory dysfunction. And therefore, we should allow an equal assessment of all patients as they walk in the door about their current health status. So if you become ill and you're concerned about possible hospitalization and access to advanced care, reach out to your Pompe expert provider. You can speak with your provider to talk about maybe creating a letter, again, stating what is Pompe disease and how it's manifesting specifically in you at this time, and whether or not you're on treatment and your response to treatment. And ensure that you have your doctor's number and that you can provide if and when you go to the emergency room. So thank you for taking the time today to discuss the impact of COVID-19 pandemic on Pompe